So what Wheeler seeks to address is there a gender difference in when we have an epidemic? Because now we talk about COVID, but we have to be prepared for the next emergency. So what have we learned from COVID is these kind of mitigation measures affecting women and men differently. And that evidence, we want to be able to use that to be better prepared for the next epidemic.
We made sure that when we were designing this project, we were embracing feminist approaches, which meant that we were going to do our best to ensure participation of all members that would be impacted by the work that we were doing. And in this case, because our focus is the unpaid and paid healthcare providers, we really wanted to make sure that the questions we were asking, the findings that we were determining, and then our interpretation of them were a true reflection of what was actually happening in the community, in the facilities, and at the policy level.
I once worked at the county government of Kilifi and headed the research portfolio for a number of 6 years. And through that, I saw that the experts, so to speak, not the scientists, but the people, the participants whose voices were being missed. So with the Women Rise initiative and through the Wheeler project, we were then given an opportunity to write a participatory approach, one that not only gathers the voices through data collection, but one that involves these stakeholders or experts, so to speak, in every step of the way.
We have the overall research team, which is like the top organ within the project. So composed of the PIs, the core PIs, and from the various institutions, the county governments of Mombasa and Kilifi, the University of Manitoba, and Aga Khan University. So, and then also looking at the will-be beneficiaries. There are two other critical organs that we have within the project, and that is what we call the LAB, the Local Advisory Board, that is composed of healthcare workers who are the technical persons, some of them who are critical in at the forefront of service delivery, and then also decision makers within that. And then we also have other collaborators. For Kilifi, the lab, we have a partner that is the Pwani University, which is one of the local universities within the county as a member of the local advisory board. Then the other key organ, this is like the basic, the foundation, is the CRAG, the County Research Advisory Group. This is largely composed of persons or members from the community level. So the primary healthcare facilities that we have, the dispensary health centers, we have a number of paid healthcare workers from that level, and we also have representation from the unpaid, that is the persons we call the community health promoters represented there.
My experience with Wheeler, I was involved from the beginning, where beginning means where the discussions started. We were involved, unlike other studies, from even the generation of the study questions. We were involved, or I was involved, like choosing the participants to participate. And for this one, specifically, we're looking at the female healthcare providers and how COVID-19 affected the employed and the unemployed. And for Wheeler, I must say that we are really waiting to see the outcomes, because unlike so many studies, it has come in with a gender, it is a study with the gender lens.
I think to me it's a learning opportunity about research, because initially I didn't know what happens during research. You could see people come in, do their research, then you don't get the findings. But in this, we are involved from the word go. You get to know your part in the research, then what is expected of you. Then now we are now moving to a step where we are collecting the quantitative data. We collected the quantitative data and then it was analyzed. Now we've collected the qualitative data being analyzed. Then we actually know, because we are moving in together,
And in between, we've had opportunities of being trained and getting, I can say, capacity building.
So for me, what I see Wheeler is it's promoting the health of a healthcare worker. I have been a healthcare worker before, served in various capacities, but we always look at the patients as the people who we should promote health for, but we forget about ourselves. So with the Wheeler, then we get a chance to speak to the healthcare workers, and I think we've seen through our interviews, it ended up being more of an interventional or a counseling session as opposed to it being a data collection, and simply because no one has ever spoken to the healthcare workers. And they are really looking forward to dissemination of this process. So I think it's going to change how we look at healthcare workers in terms of being those who are strong and those who are held accountable for other people's health, but we should also hold ourselves accountable as government in terms of protecting our army, so to speak, within the health sector. So they had a lot to say within the Wheeler study, and we wish we could do more, or do more of this in other counties who have not had the chance to experience Wheeler. But it's a gap that we need to make change in how we do health going forward. Let's take care of our healthcare workers. They may not come to you or go anywhere else to say, you know, I'm suffering or I'm ailing or I don't understand what I'm going through, because they're expected to be at work. So for me, it's been, I can say, a reward, so to speak, and a gift that I can give my healthcare workers by, you know, putting their voices or promoting their health through this study.
A number of key achievements have been made during the process of the project, and just to highlight a few, I think one of the key one is that human-centered design approach that we've had, and the impact that it has had on within the county government. And because we've done quite a number of researches or projects within the county, and largely we've been in them as implementers. But for this particular one, and the participatory approach that it has, is we've been involved from the conceptualization of the project. So that is one key aspect that we've been able to learn from, and probably it will, you know, impact on how we interact with future projects in future. The other thing is, I think there's a lot of capacity that has been built within the life of the project so far. And one key is, you know, in terms of resource and capacity building, we've had a resource center, two actually resource centers, and through the project, key items, especially ICT equipment, have been procured, and a center has been established at the main referral facility, that is the Kilifi County Referral Hospital. And people are already benefiting from this resource center.
So some of these findings actually proved to us what has been there in the quantitative. Once the quantitative findings or results had been analyzed, it actually gave us a perspective what was the different as Mombasa County as compared to Kilifi County, as some of the findings were like the healthcare community healthcare promoters are more learned in terms of in Mombasa as compared to Kilifi County. So these were some of the things we didn't know, but through the study we could find. We are actually being involved in the study itself, so it actually helps us to follow up with some of the findings that have been there in the quantitative, and we follow up in terms of qualitative as well.
We do appreciate Wheeler for involving the community 100% inclusivity. So to add on mobilization, remember we had the paid and unpaid workers, where we needed the information, we didn't know how, we needed the feedback from the community on matters COVID before and after. So Wheeler 100% made sure that the community is involved at different stages. And it's the first time, I've never seen any organization being able to involve the CHP in workshops that we have the leadership, especially the gender workshop where we had the directors in, the CRAG and the lab team. Even we had the opportunity to have the part of the CRAG team, that is the CHP, exactly 3 in Mombasa, that were able to be trained and also get a certificate of the same, owing to the fact that they're going to give feedback and dissemination to the rest. This acts as a recognition, it's an incentive, and it also makes them feel important, that the work that they do in the community is very key.